Hello, everyone. Welcome to our briefing. This briefing is presented by WorldAware. WorldAware provides intelligence-driven risk management solutions that enable organizations to operate globally with competence. WorldAware's end-to-end tailored solutions, integrated world-class threat intelligence, innovative technology, and response services help organizations mitigate risk and protect their people, assets, and brand reputation. Our speaker today is Tumi Wallace. Tumi is a senior intelligence analyst focused on Eastern Europe and Central Asia. He studied political science and history, followed by postgraduate law at the University of Cape Town. Tumi has previous experience as a policy analyst in criminal justice for a Texas state senator and as a strategy consultant for the consumer industry and government in Cape Town. Tumi is going to brief on the COVID-19 recovery in Eastern Europe and Central Asia. Tumi?
Thank you. As we're approaching summer in the Northern Hemisphere, we're increasingly seeing governments diverge in how they respond to the pandemic. Most countries have now been under some form of lockdown for about 2 months, and reopening their economies is becoming a priority. We'll be looking at several countries in Eastern Europe and Central Asia in the context of 4 potential medium-term scenarios. WorldAware developed these scenarios internally to evaluate government responses to the COVID-19 pandemic. The scenarios are titled Health First, Incremental Normalization, Business First, and No Normalization. We're monitoring a range of generic and location-specific indicators to determine the relevant scenario. While no one framework will be a perfect fit to any location, the general characteristics of each scenario are as follows. In Health First, governments will maintain strict restrictions, which will have a significant negative impact on business, though crucially, maintain public support. Incremental normalization, this might be called the best case or least disruptive outcome. Governments and businesses carefully roll back restrictions and tread the fine line between public safety and sound economic management. There will still be a moderate impact on business, but better than might otherwise be hoped. In Business First, governments and businesses prioritize the need to get the economy going again and quickly roll back health restrictions, which has positive short-term effects for jumpstarting the economy, but also has a negative impact arising from public health issues and consequent negative public sentiment. Finally, in no normalization, government and business restrictions remain in place, causing severe business impact. The main difference between this scenario and Health First is that the public is not on board, with widespread dissatisfaction manifesting as disobedience to government restrictions, growing political opposition, and civil unrest. We first need to quickly address some key challenges when it comes to intelligence gathering in Eastern Europe and Central Asia. Their adherence to democratic norms such as transparency, state institutions, and press freedom is relatively poor in comparison to elsewhere in Europe. This can make it difficult to gather accurate and reliable health information, not just for WorldAware, but for the media and the World Health Organization. Several of the countries we will assess in this briefing have significantly downplayed the extent of the pandemic in their country. Some of these countries have at some point denied the existence of coronavirus altogether. Additionally, protests and other forms of civil dissent are much more restricted than elsewhere on the continent, so the relative importance of public sentiment is somewhat reduced. That being said, civil unrest can be particularly pertinent in an environment where any form of dissent is quickly silenced. Throughout this briefing, we'll repeatedly refer back to these points, as in many cases they influence our key drivers and therefore have an impact on our assessments. Russia initially seemed like an outlier, remaining COVID-free through March, while cases increased in Europe and the US. However, Russia has now recorded the highest number of cases and some of the highest rates of infection in Europe. Over half of those cases have been recorded in Moscow. Given the country's vast size and varying population density, the epidemiological situation varies greatly from region to region. Accordingly, President Vladimir Putin empowered regional governors to take action over and above federally mandated guidelines, and different regions have thus taken very different approaches to combating the pandemic. We have taken as broad an approach as possible to our assessment of Russia. country is now past through the peak of infections, and authorities feel they're in a position to begin tentatively achieving incremental normalization. We rate there's only a 45% chance of this scenario being realized in the next 90 days, and a 35% chance the country will take a business-first trajectory. After initially imposing a hard lockdown to slow the rate of infection and prevent hospitals from being overwhelmed, Russia has begun to ease restrictions, particularly in Moscow, as of June 1st. Several specialist hospitals that were repurposed to treat COVID patients are due to be stood down by the end of this week. They will once again begin treating non-COVID patients. Temporary hospitals that were created to handle the peak of infections will remain in place, however, in case of a spike in infections. Although cases continue to rise, authorities feel they have brought sufficient excess capacity online. Movement restrictions have been eased, but controls on the use of public transport and long-distance travel remain. Prior to June 1st, restrictions were eased in stages. An official non-work period, which is Russia's version of a stay-at-home order, came to an end May 12th. Officials in Moscow and St. Petersburg and at least 10 other regions allowed some industrial and construction work to resume. Small shops and outdoor markets have followed. This is all consistent with an incremental normalization scenario. Although the public has been largely supportive of the government's approach, concerns have been raised regarding the pace restrictions are now being lifted and whether a sharp spike in infections is looming. Russia's economy is likely to face serious challenges with both consumer demand and global oil prices projected to remain low. We therefore assess that there's a fair chance the country will enter a business-first scenario. In some regions, restrictions lifted mid-May were quickly reimposed following an increase in cases. Authorities are yet to announce a major economic relief package, although some reports indicate discussions have begun between Putin and regional leaders. The priorities will be getting Moscow running again, along with some regions with high industrial capacity. A resultant spike in cases in Moscow and those industrial centers that have reopened will indicate the country has followed a business-first trajectory. If Russia experiences a sustained increase in new cases, there's a small chance the country will shift back to the health-first strategy. There's a much smaller chance of a massive increase in infections and a resultant no normalization situation, with widespread unrest and civil disobedience in relation to the COVID restrictions. It's likely that we will continue to see wide divergence between the situation in larger Western cities, such as Moscow and St. Petersburg, and the more sparsely populated Siberian and Far Eastern regions. We will monitor several indicators to continually assess the country's response to the pandemic. Firstly, we're going to monitor medical data to determine whether overflow capacity is sufficient to handle a rise in new cases. We'll also monitor the reliability of such data. The national media and some regional health officials have indicated that strict reporting standards are artificially depressing the case fatality rate. We're monitoring announcements regarding major public events. Authorities have announced that the Victory Day parade will take place June 24th, and that a constitutional referendum is tentatively scheduled for July 1st. Public participation in these events will be strong indicators of whether residents feel the government has brought the outbreak under control. We'll also monitor opposition groups for calls to protest against the relaxation of restrictions or adversely calls to further open up the economy. Russia has a history of clamping down on dissent. We'll therefore take note of whether the government uses the ongoing ban on public gatherings against the opposition in the build-up to the constitutional referendum. Finally, we'll also note whether any stimulus package is sufficient or merely aids major Kremlin-linked companies at the expense of small and medium enterprises. Kazakhstan implemented harsh measures to stem the spread of COVID-19 early on in the pandemic. Authorities began to restrict international travel from late February, and flights between Kazakhstan and COVID-affected countries were suspended from early March. A state of emergency was introduced March 15th, with blanket bans on international and domestic travel. Internal restrictions were relaxed by late May, but a ban on inter-regional travel remains. Further restrictions and local quarantines will be lifted in stages on a case-by-case basis. Kazakhstan is set to tread a path between the economic necessity of reopening and the continued public health risk posed by COVID. We currently rate that a business-first scenario is the most likely outcome in the next 60 to 90 days. However, there's a fair chance the country will fall back to a no normalization scenario. Having taken a hard lockdown approach early, thus slowing the rate of infection, authorities are under economic and public pressure to ease restrictions further. Medical infrastructure is relatively sound and has so far been capable of managing the COVID-19 caseload. The government may therefore feel confident in lifting restrictions without triggering an exponential rise in infections. However, the health services have suffered from underfunding in recent years. This could make them more vulnerable to a sharp rise in cases following any relaxation of measures. Poor medical data arising from low testing numbers and an ineffective contact tracing program could also complicate the challenge of matching scarce health resources to meet an unknown demand. This might encourage authorities to maintain or reintroduce restrictions in the coming months. The hard lockdown and the resultant decline in consumer demand has placed the government under pressure to reopen businesses. Domestic economic pressure has been exacerbated by falling demand for petroleum goods in the country's principal export markets, notably China and Russia. Additionally, key economic facilities such as the oil fields in the west of the country could prove to be COVID hotspots as restrictions are further eased. There have already been some concerns raised around the Tengiz oil field, where almost 1,000 people tested positive in late May. The perceived higher threat around such important facilities could prompt the government to introduce targeted local restrictions around them to further isolate them from the wider population. Another important factor at the Tengiz oil field and others like it is that they have a relatively high proportion of Chinese workers. Prior to the COVID-19 pandemic, Kazakhstan was experiencing a steady increase in protests over Chinese mega projects in the country, the reliance on Chinese workers, as well as over the perceived treatment of Uyghurs, Kazakhs, and other Turkic Muslims in China's Xinjiang region. The government is typically capable of limiting the effect of negative public sentiment, but authorities are unlikely to be significantly concerned over a short to medium-term public backlash around their COVID policies. However, it is possible that negative sentiment could manifest itself in protests denouncing foreign interests and other civil disobedience. Workers may down tools, refuse to return to facilities, or clash with their Chinese colleagues. Sinophobia has been a small but growing issue in Kazakhstan, and a sharp increase in cases could fuel tensions. There's a small chance that Kazakhstan enters an incremental normalization scenario, where restrictions are lifted without endangering public health and prompting negative public sentiment. However, the likely inability of the local health infrastructure to withstand a rapid resurgence in cases, alongside likely inadequate testing and tracing, means this scenario is currently less likely. Limitations on health services, as well as the government's strong desire to mitigate the economic impact of a protracted lockdown, mean that a health-first scenario is also highly unlikely. We will be monitoring the indicators that would determine whether the government is planning on extending, relaxing, or reintroducing restrictions. These actions would differentiate between whether the country will enter business first or no normalization. In particular, we'll be looking for announcements over the reopening of Kazakhstan's international borders, as well as health authority decisions over the operation of the Tengiz oil field. Any closure or limitation of such facilities would increase the likelihood of a no normalization scenario. In addition, we'll be looking for signs of whether the government is planning to relax nationwide restrictions on inter-regional travel or move towards a more targeted, restrictive regime based on locality, industrial sector, or demographic group. Finally, we will examine case data. We need strong and reliable case data that indicates the rate of infections is slowing and that medical capacity has not been overwhelmed. This would assist the country in combating any resurgence and enable it to move towards incremental normalization. Tajikistan's an interesting case. Authorities denied the presence of COVID-19 in the country up until April 30th. A sharp spike in fatalities as a result of respiratory illness was, in March, officially chalked up to a pneumonia outbreak. The relatively light business and movement restrictions that have been introduced have had a significant impact on the economy and public sentiment. We therefore assess that Tajikistan is likely to maintain its business-first approach over the next 60 to 90 days. The government response has been very lenient relative to other countries, and enforcement of restrictions has been lax. Although authorities closed international borders April 10th, the economy officially remained open until early May. Even now, the government has only ordered the closure of large marketplaces and the suspension of national sports leagues. State-run farms have continued to plant cotton, requiring employees to come to work, and this has caused some tensions, and there have been reports of laborers scuffling with state officials. Other major industries such as aluminum smelting, chemical production, machinery, and metalworking industry continue to operate. Although face masks are mandatory in major cities, there are few discernible COVID hygiene measures being implemented at factories. Many restaurants, bars, and cafes in Dushanbe unilaterally closed to patrons in the absence of a directive from the government. There have also been reports of unrest. Chinese workers at a northern factory clashed with police after they downed tools and demanded to be sent home. With international borders closed, they've been forced to remain on site beyond their mandate. Elsewhere, state-run bakeries and grocery stores have seen small protests over shortages and high prices. Despite implementing few business restrictions, we can see that the already weak economy is under strain, and this is being transferred to consumers. The strongest driver behind the government's business-first approach is economic. The state would find it extremely difficult to effectively support all those who would be unable to work under a strict lockdown. This is currently perceived as a greater threat than that posed by COVID-19. Additionally, it's believed that the president, and certainly his family and close associates, have personal financial interests in keeping large industries going. Finally, the opposition doesn't pose a credible threat to the government, and as a result, the president is under little domestic political pressure to tighten the lockdown. The government has belatedly formed a COVID-19 task force and cancelled large public gatherings such as the traditional outdoor Eid al-Fitr celebrations. However, a health-first approach is deemed unlikely. It would place severe pressure on the economy and risk a collapse. The government would only consider this approach in the face of a massive increase in case numbers, and then likely only for a very short time. We'll be monitoring infection rates and case data. If rates fall or remain at levels which the authorities deem acceptable or are efficiently able to manipulate, then the government's approach is unlikely to change. However, we have seen through this pandemic that cases can reach such a crisis level that no amount of manipulation can cover the reality on the ground. Should this occur in Tajikistan, then we may see the government change approach. We will monitor the availability of PPE and ICU beds. Authorities have brought on spare capacity, but it could easily be overwhelmed. The government continues to maintain that hospitals are under capacity and that they're capable of dealing with the problem. This could be a false narrative, so we're going to keep a close eye on that as well. Protests, strikes, and other civil disobedience against the weak government response could prompt tighter restrictions, as this would indicate that the situation has worsened and force the government to respond to public concerns. Given that the authorities have a history of responding violently to dissent, it would take massive action combined with international pressure to convince the authorities to change tack. Belarus has also taken a very light approach to fighting COVID-19. President Alexander Lukashenko has been repeatedly dismissive of the COVID-19 threat, even going so far as to call it a psychosis. The onus has been placed on employers to ensure sick employees don't come to work. Restaurants and hotels have remained open with minimal COVID measures in place. There appears to be little chance that authorities will adopt anything other than the current business-first scenario. we rate there's a very high chance the country will continue with this strategy over the next 60 to 90 days. The government response is far more limited than most other countries in the region. There are minimal movement restrictions and businesses have been allowed to stay open. This is being maintained while the country has one of the highest per capita infection rates in Europe. The government went ahead with a large-scale parade for Victory Day on May 9th, and thousands attended without PPE and socially distancing. Other major events are scheduled to go ahead. The presidential elections are set for August 9th, and election rallies have taken place over the past 2 weekends. Some labor organizations have come out against the government, particularly those representing healthcare workers. While we haven't seen any protests explicitly calling for a greater response to COVID, we have seen some election rallies morph into anti-government demonstrations. The EU and the WHO have called on Belarus to implement tighter restrictions. However, it would take immense international pressure to force Belarus to change tack at this stage. A major driver in this approach is likely economic. Belarus has a weak economy, and the state would find it extremely difficult to support all those who would be unable to work during a lockdown. This is currently perceived as the greater threat than that posed by COVID. Taking such a light approach to this disease can have obvious negative consequences, but a health-first approach is still unlikely. While the Ministry of Health has taken the pandemic more seriously than the president, the nature of Lukashenko's power limits what the ministry's ability to openly contradict his claims. Opinion polls have shown many Belarusians disapprove of the government's response, while many people have indicated they are socially distancing or wearing face masks. These efforts are only effective if the majority of the population follows suit. There is a threshold at which the threat from COVID exceeds that of the possible economic fallout likely during a lockdown, but it remains to be seen if this threshold is reached. Authorities have ruled out incremental normalization or no normalization strategies. According to official statistics, the death rate is fairly low and new infections have plateaued. The government claims it has a robust testing and contact tracing program in place. However, this is problematic. The government statistics are likely unreliable, and the new infection rate is still the highest in Europe after Russia and incredibly high per capita. One of the main drivers we'll be looking at is the incidence rate. If the rate falls or remains at levels deemed acceptable to the government, then the approach is unlikely to change. Similarly, if the government is able to sufficiently hide increases to achieve the same end, then again, the approach is unlikely to change. However, if the situation becomes so stark that it undermines the government's narrative, then this may force Lukashenko to impose tighter restrictions. Mass protests and civil disobedience could also prompt tighter restrictions. A spike in cases in workplaces could prompt a strike, and an extended strike would place massive pressure on the economy. The cancellation of public events would indicate that the government is beginning to take the pandemic more seriously. We are monitoring announcements regarding the upcoming presidential election. The government continues to maintain this is going to go ahead in line with its business-first approach, but any changes to campaigning procedures or a pushback of the date of the election would indicate the government is changing approach. This is important given the role elections have in lending legitimacy to Lukashenko's rule. However, and for this reason, any changes would likely be made at the last minute and out of dire necessity. None of these scenarios is a perfect fit for any one location, but the fact that many countries in this region have underfunded medical infrastructure, weak states, and struggling economies suggests that business first will be a preferred approach. However, countries that suffer acute health crises, which will likely be blamed on the government, will also have the potential to achieve shades of no normalization. There will be no identifiable moment where the impact of the pandemic suddenly ends. Residual restrictions, possibly targeted by age, location, or occupation, will remain and likely be reintroduced at short notice for the foreseeable future. Many people will likely continue to restrict their own activities out of an abundance of caution long after the government has relaxed official measures. Even the idea of normalization is relative. Consider that the Western world never really returned to normal after 9/11. The same is true now. Individuals, countries, and businesses will adapt to their routines, in this case through social distancing, flexible working, and more cautious travel procedures.